Question 1. Who is permitted to document and assign Z codes for SDO each? A. Physicians and nurses only. B. Physicians, nurses, and other non-physician providers. Answer C. Physicians only. D. CDI specialists only. Question 2. In its 2020 review, in what area did the OIG find that almost 90% of codes submitted on claims were upcoded? I. Injections. B. Psychotherapy. C. OTPs. D. Severe malnutrition. Answer question 3. Which of the following qualifies for the federal IDR process? A. Medicaid. B. Medicare. C. TRICAE or ED. None of the above. Answer. What is the main difference between a simulation angiogram and a vascular embolization? A. One uses Y90 embedded beads and the other does not. Answer B. One is reimbursed and the other is not. C. One is performed in an outpatient setting and the other is performed in an inpatient setting. D. There is no difference. Which of the following is a Medicaid requirement for high hyaluronic acid HA injections for knee osteoarthritis? Patient has hip or shoulder osteoarthritis confirmed by MRIB. Failure of conservative therapy such as NSAIDs, physical therapy, corticosteroids. Answer C. Diagnosis of unspecified osteoarthritis M17.NINE without laterality. D. Use of any compounded HA product, FDA approved or not. True or false? A non-emergent service provided by an out-of-network provider at an out-of-network facility qualifies for the federal IDR process. A. True. B. False. Question 7. Which type of cancer accounts for 80% of all breast cancers? A. Ductal carcinoma in situ. D. CISP. Invasive lobular carcinoma ILCC. Each ER2 positive breast cancers. D. Invasive ductal carcinoma IDC. Answer. Question 8. A provider documents the use of the standardized tool PHQ-9 for developmental screening of a patient and reports a score of 9, suggesting depression. Office staff time of 30 minutes is documented. Which of the following is an accurate statement? A. The screening cannot be coded on the basis of time. Answer B. The screening can be coded with modifier 59 and an EM based on time. C. The 30 minutes can be added to EM service time. D. The screening cannot be reported separately. Question 9. Which CPTE code range denotes open excision of a breast lesion? A. 19,000, 110 minus 19,000, 126. Answer B. 19,000, 281 minus 19,000, 288. C. 19,000, 300 minus 19,000, 307. D. 77,046 minus 77,049. Question 10. What is a metric that can be used to continuously monitor the effectiveness of an SD or each CDI program? A. Patient satisfaction scores related to SD each discussions. B. The prevalence of reported Z codes. Answer C. The number of non-physician providers on staff. D. The total number of patient visits per month. Question 11. A provider administers Synvis 1 to a patient's right knee under ultrasound guidance. What coding is correct for billing both the drug and the injection procedure? A. J7325, 20,000, 611 RT. Answer B. J7321, 20,000, 610 minus 50. C. J7325, 20,000, 610 LTD. J7327, 20,000, 611. Question 12. According to Medicare policy, which item is NOT covered under enteral nutrition services? B4152 standard formula. B. B4035 pump supply kit. C. B4100 food thickener. Answer D. B9002 infusion pump. Question 13. When using the OPG, which of the following components are most critical in determining the assigned payment group? A. Place of service code. B. Rendering provider specialty. C. CPT CPCS level II procedure codes and revenue codes. Answer D. Patient age and gender. Question 14. How should hospitals report complex embolization procedures of the TriNav infusion system on Medicare claims? A. C8004B, C1982C, C9797. Answer D. 37,242. Question 15. Which of the following best describes the purpose of OPGs in claim adjudication? To assign DRGs for inpatient reimbursement. B. To bundle outpatient services into clinically related groups for consistent payment. Answer C. To determine risk adjustment factors for Medicare Advantage. D. To validate CPT code accuracy against NCCI edits. Question 16. When evidence of overpayment exists in an audit, how many days do healthcare organizations have to investigate and return any overpayments? A. 15. B. 30. C. 45. D. 60. Answer. Question 17. Which modifier is used to indicate a patient has an enteral nutrition pump on a rental basis? A. Newbie. Or answer C. KXD. MS. Question 18. 3-year-old child visits the doctor for a preventive checkup. The provider notes that a general developmental screening was also performed. How should the screening be coded? A. Code for the time spent on the assessment. B 96,100, C 96,127, D. The documentation lacks sufficient detail for coding. Answer question 19. Which CPTT code should be reported when a partial mastectomy is performed with a complete axillary lymphadenectomy? 19,301B, 19,302. Answer C, 19,303D, 19,307. Question 20. According to current guidelines, at what age should screening mammography begin for individuals at average risk for breast cancer? A 35, B 40. Answer C, 45, D 50. Thank you for watching my video. Please like and subscribe.